Ladies and gentlemen, at 2 p.m., Dr. Pavel Anders will present a seminar on well-root ST&PT. Please join us. Ladies and gentlemen, at 2 p.m., Dr. Pavel Anders will present a seminar on well-root ST&PT. Please join us. Ooh. 아니 이 사람 우리한테 계속 하는. Here, Mike.
Okay. How to? Sorry. It's.
이렇게죠?
Mm-hmm.
And maybe 여기도 기다려도 되고.
왜냐면 이게 안테나를 가리면 끊겨.
1, 2.
괜찮아요?
How to switch it off?
Switch it off like. 여기서 하면 되죠? 안 보이고 싶어요. 안 보이고 싶어요. 어떻게 읽는지 물어보길 잘했어요. 어. James, we need to move.
Okay.
시작할까? Can we start?
Yeah, can we start?
Hello, everyone. Thank you for joining us today. It's a great pleasure to introduce Dr. Pavel Anders, a highly experienced professional. Please give him a warm welcome. Welcome.
Thank you very much. My name is Pavel Anders. I'm practicing dentist. I came from Poland. I'm from beautiful city Szczecin. I work part-time in University of Szczecin, Medical University of Szczecin, and this is our city. I'm fascinated with bioceramics since more than 15 years. I tried many materials. I tried, first of all, MTA. In Poland, we even had time that we made, somebody in university made kind of copy of MTA, of Portland cement, yes, made because it was so expensive. So we had in small bottles, in a small group, yes, just to use with our patients. So I started this way. Then I started with different materials. And my goal as practicing dentist was to find material that is predictable, easy to use, I'm general dentist. I'm not so sophisticated. And my patients many times coming to my dental office from different cities, or they're young, studying in different city. And the biggest problem was pulp exposure, deep caries, and to treat these patients the way that they can let them go the same day, yes? And that was my goal. And the result of my looking for material that is fulfilling my dreams is WELRoot PT. Also, we have root canal sealer, WELRoot ST, so syringe type. And let me share with you with some cases of mine and some cases of my friends and the predictable procedures that are contemporary dentistry. So we have guidelines, we have consensuses, books, lectures, also experience, and the things that few years ago would be against the rules, would be leading us to the doctor's court, yes? And I'm, by the way, in board of doctors, in our board of doctors, kind of prosecutor before cases will go to doctor's court. I'm make interview with patient as a witness, doctor as person in whose or her is a case, yes, dismissing. Of course, we are colleagues, yes. So usually I'm dismissing the case, but sometimes we sending to Doctor as root canal sealer. This is my daughter, and I'm also training magical potions, yes, in Warner Brothers, as you see. And this is my patient from about 2 weeks ago. And these pictures are not from my dental office. This came from the patient, and his problem was pulp exposure. He got these pictures from his dental office, yes? He had deep caries, and he's, I may say, kind of friend of mine. I know his parents. And he told me, Dr. Anders, I had pulp exposure. This dentist treating me for a long time. And he said, we're doing endo treatment. You have pulp exposure. I said, no, please, no. Do use bioceramics. You know, he knows I'm big fascination of bioceramics. And they sketched some bioceramic materials. They put bioceramic materials. And as you see, it partially fell off, yes? And he came to me. I was not in dental office. I was in other place. Okay, I take a picture with mobile phone. And but go to your dentist. They put some temporary filling. It fall out, yes? Next few days, I say, I feel pain, it's winter. When I'm breathing, I feel cold, yes, because dentist is exposed. Okay, come to dental office. I removed all this other bioceramic material. I put WELRoot PT. It was, the dentate bridge started creating. There was no bleeding when everything fall out, yes. I cleaned the cavity. I cleaned the cavity with air abrasion. I'm a big fan of air abrasion. Then I put WELRoot PT, then I put light cure base material. In this class 2, it was quite difficult, but I managed. And filling, yes, and the composite. And now, 2 weeks after, he's happy. Just before coming here, I was in dental office. I checked his reaction on the cold, reaction on the Faraday, yes, and everything is fine. Tooth is vital, yes. So we may say, most probably, and the reaction is exactly the same on his tooth being treated and the opposite tooth. So looks that it will survive. Yes, this is just one case. So we facing with deep caries, and it looks very similar from this point of view, but on the X-ray, we see if caries is reaching only dentin, or if caries is reaching also pulp. I will show you on diagrams. We still use bioceramic material like WELRoot PT, but our procedure is just a little bit different, yes, in these cases. First case, pulp exposure, yes, like my young colleague, yes. So dentist accidentally exposing the pulp. In this case, we brushing with sodium hypochlorite. Sodium hypochlorite is doing also hemostasis, so it stopped bleeding, yes? Then we're putting WELRoot PT, any glasionomer, it could be glasionomer from VERICOM, and a glasionomer could be also light cure-based material. The point is, WELRoot PT is bioceramic material, yes? It's calcium silicate, aluminum calcium silicate in this case, and it's highly alkalic. Yes, pH is very high. Our bonding system, our etchant, if you use etchant, is highly acidic, and we know what's happening when you add strong acid to strong alkali thing. Yes. So we have to protect the material from and this base material is only to protect the material from the bonding system. Is that clear? Yes? And then we put the filling, and the patient is gone. However, this is accidentally, and what we are doing now with this magical potion, yes, with bioceramic material, with well-root PT, is trying to save our tooth from pulp capping. Yes, we can stop our operation earlier. This is another case from my colleague from the same faculty of university. Pulp exposure, stopping the bleeding with sodium hypochlorite, well-root PT, glass ionomer, and permanent filling. Yes? Huh? Well-root PT? That's a very good question. Doctors ask, is well-root PT slide cure material? What we know now, yes, and right now I'm saying what my professor says to me, that light cure materials, being stated as bioceramic materials, professor says it's kind of toy bioceramic materials. So this is bioceramic material that is setting only in presence of moisture in cavity. We don't have to light cure it, we don't have to wait. That's a very, very good question. And this is why it's my magical potion, because maybe it was not clear. I can immediately put base material, so gas ionomer or light cure material, after placing well-root PT. This changed completely my procedure, yes? Because I can stop the bleeding in this case with sodium hypochlorite, and by the way, it doesn't matter what percentage is sodium hypochlorite in this case, yes? So it can be any percentage. Papers do not show, or procedures of dental associations and odontic associations don't show precise, it doesn't matter, sodium hypochlorite. It shouldn't be chlorhexidine, by the way, because it can affect setting of bioceramic material. So sodium hypochlorite, well-root PT, and you will see on the movie how beautiful consistency is. Also, there will be workshops so you can play by yourself, yes? And immediately I can place base material and seal the cavity with the composite. So it's predictable, easy, and fast. And yeah? Yes?
So if it needs moisture,
In cavity is always a little bit of moisture.
you drying well, you rinse everything and drying it?
No, we have pulp exposure.
Yeah.
We're rinsing with cotton swab the cavity with sodium hypochlorite. Yes, this stage, and then you can rinse it with distillate water. Yes, and place well-root PT. That's it.
No air dry.
Don't air dry too much. Yes, the well-root PT will attach to the dentin easily. Yes, and then immediately you can place base material, which saving a lot of time. So the procedure is also very ergonomic, very easy to do. Yes, and then composite, and patient is gone. Yes, and very high percentage of success. Another case. Yes, and now you see consistency of the material. Please look. It's almost like the temporary filling consistency, so it's a little bit, I would say, less viscous than temporary filling. So it's very, very easy. You will see with your own hands, yes, right now after the lecture. It's very easy to place. I like it very much. So next situation, similar to what we have, but we're trying to avoid endo and pulp capping. So we clean. We have the caries, and here we have demilitarized dentin. And few years ago, we would clean it and we would expose the pulp. Right now, with the new consensus, with the new regulations of endodontic societies, we very carefully clean the walls of the cavity, and we're leaving this demineralized dentin at the bottom, yes? And then we're placing sodium hypochlorite, well-root PT, yes? And base material, could be glass ionomer from VERICOM, could be light cure base material, whatever we want, yes? And then, what happened? Oh. And then restoration. Is that, yes? So this is the way to save the patient from endodontics, which is not 100% predictable, which costs time, money, yes? And this procedure is predictable, and what's important, you see, this is final restoration, yes? So we leave it, and this dentin will be remineralized through action of bioceramic material, well-root PT, yes? But easy of use of this material to place on the bottom cavity is excellent. So this is why I like it so much. Next situation that we may face, on the X-ray, yes, we see that caries is reaching the pulp. A few years ago, it would be 100% endodontics. Yes, how many endodontists are here? Wow. I'm taking money from you with this procedure, yes? And sorry about that. But you know that we're going forward, yes, in our dentistry. We're trying to save the teeth. And we're doing similar things. We're cleaning the walls to the white dentin, yes? But we're leaving this, not demineralized, I would say caries dentin on the bottom of the cavity. And this is completely breakthrough, yes? A few years ago, we would be sent to the doctor's care for leaving not prepared caries and not making endo. Right now, with the contemporary rules, yes, and procedures, we leave it, sodium hypochlorite, base material, but glass ionomer, and I suggest you glass ionomer from VERICOM, as long-term temporary filling. And we leave it for 1 year, and dentin bridge is creating. Another case, partial pulpotomy, yes, in the case when the pulp is already a little bit affected, yes, and pulpotomy in children is the similar situation, but we also sometimes now can make pulpotomy also with adults. So we can save the vital pulp when we're using this bioceramic materials like well-root PT, just making this kind of pulpotomy. Yes. What's also important that it's not only creating of hydroapatites, but well-root PT or other bioceramic materials as well, they changing the work of inflammatory factors, so the creating of dentin bridge has multiple factors, yes? That's also important. This is tooth with resorbed roots after pulpotomy. So well-root PT left here, that was pulpotomy. Primary tooth roots were nicely resorbed, tooth fall out, yes? Also, well-root PT is, because of consistency, is material of choice in case of injuries, yes? In this case, when here is exposed pulp, or it would be exposed pulp, this material is excellent for this kind of cases to protect the pulp, to have the tooth vital. Another great use of well-root PT is apitectomy, and well-root PT has very unique feature. My friend Professor Lipski from Szczecin made a paper when he compared another bioceramic material and well-root PT, and you can find the paper, and this so-called washout effect. Yes, so in the situation when surgeon is filling retrograde, so removing a little bit of filling of the canal and placing bioceramic material as retrofill filling, in this case, this material has absolutely no washout effect, almost absolutely, after 2 minutes. So I have many friends. I do not do a apectomy by myself, but many of my friends, when I shared with them the idea of this material, of well-root PT, particularly this material, they say they hated apicectomy, yes, until I gave them sample of well-root PT, yes, from my dental office, yes. It's beautiful consistency, as you saw, plus no wash effect, makes it material of choice for apicectomy. Also, interesting, and I'm pressing something? It's something happened. It is on computer. Any questions in the meantime? Anything? I don't know what. No? Okay? Now? Okay? I'm not touching anything. Sorry about that. Huh? Hmm? Yes? Any questions? Mm-hmm. Maybe to the microphone, doctor, okay? Could you please repeat for the colleagues? It's not. Okay. The question from the doctor is, if I place well-root PT on the pulp, do I condense it? And just placing, just gently with a cotton swab, maybe a little bit. But what's also very important, when we used to use MTA, yes, because all of this are hydraulic cements, yes, just to refresh your memory, yes. They are hydraulic cements, and they need water for the reaction, yes, for setting, yes. So in well-root PT case, this is premixed material, which we saw. This is crucial. This is premixed material. So just little bit of placing it with cotton swab is enough. We don't need to put additional water to this. Yes, is it? Yes. And then no need for condensation. And I show you one more case about the case that doctor asked. One more case about pulp capping. This is from my colleague Maximilian Kaczewik. He's doing a lot of his work, also lectures about lasers in dentistry, yes? And laser is very interesting medium to stop the bleeding when we have pulp capping. This is just 2 additional slides. We have cavity after stopping bleeding after pulp exposure, yes? Well-root PT placed, yes? I don't have all the slides for this case, but look, this is after treatment, yes? Immediately made post-op picture. And here's the beauty, what we expected. You see here, the dentin bridge. This is 14 months after the procedure, yes? He sent me this today. This is beautiful case showing us how dentin bridge is formatting, yes? How we save this tooth. This is apicectomy. I'm just showing you how nicely is to place well-root PT and then wash the cavity of the apicectomy. After 2 minutes, we can wash it with saline, and it stays where we want to stay. So this is the guy who told me he hated apicectomies, and after well-root PT, he loved it. So this is case which is for some of you, maybe looking like experimental case. No, revitalization, revascularization, apexification is something that we can do, yes? So just, this is why I call it zombie tooth, yes, because it was non-vital anymore. There was pulp was excavated, yes? Then, of course, we put antibiotic for a period of time. There's procedure for that. There's no time now to discuss it later, yes? And we, after disinfection, we, through this open wide root canal orifice, yes, we create bleeding, so we're scrubbing this, yes? And this blood is starting coagulated. We're putting bioceramic material, and well-root PT is excellent because of consistency for that. And this plug, and temporary filling, of course, and this plug is creating revascularization, so the veins are growing, yes, to this coagulum, and it will be never the pulp, but we call it like pulp tissue. So this will be never vital tooth, but it will be kind of zombie. Still better than non-vital tooth. It will never be vital, but enough vital to close the apex. Yes, this is from my friend Professor Lipski, nice case. We can save the teeth also this way, especially with this young people, yes? Any questions about well-root PT, bioceramic? So kind of sister material, brother material of putty, so well-root PT putty type, is bioceramic as a root canal sealer, yes? It's also very easy, predictable, nice, because it's just to inject material, bioceramic material, well-root ST to the canal, and place gutta percha, easy, predictable for every dentist. Yes, so again, sorry colleagues endodontists, easy cases, now we can treat easy and predictable in our dental offices. This is a small movie that I made with my daughter for you, how to place well-root ST. So the rules are, we have syringe, we have nice calibrated cannulas, and don't be afraid that this cannula is so wide, yes? It doesn't have to reach the full working length. It has to go half or 2/3 of the root canal length, yes? Don't press it too deep, yes? Because otherwise you can express a little bit too much. What's good in this case, usually there is no pain when we overfill the root canal. All the pain is going out very shortly, yes, after a few days. But usually there is no pain. So this is another wonderful thing about well-root ST, that in situation that we do something little bit wrong, yes, and we overfill the root canal, there is no big complications for the patient. Gutta percha and the instrument. First of all, we establish with endostopper the working length, yes, and we preparing the instrument. Then we unscrew the syringe, screw the cannula, calibrated cannula that is in the box. There are many of them, so it's single use. And I'm always checking if the flow is proper before I press it also to the root canal. Pressing, it goes how deep it goes, not too deep, and I'm expressing the material, right, to the canal. Then I'm taking the instrument, this is what Professor Lipski advised me also to do, and to the working length. Now to the working length, I'm spreading the material in the canal, and then one gutta percha point. Yes, it's enough. It's enough. And good practice is to, and this paper is also showing that it's good, to have gutta percha point with material on it. And the easy thing is to put it to the cannula that we don't need anymore, yes? And this is my favorite forceps from Lashal, that is transmitting tactile sense for placing gutta percha. VERICOM is also showing here very nice device to cut the gutta percha at this point. Yes, may you see it? Yes? It's something like this, yes? And it's not only creating heat, it's new also for me, but I like it when I tried it here extraorally. It's also vibrating. So very nice device to cut do gutta percha and a little conceit at the same time. And in the case of hot gutta percha, we can use this material, the solvents in this material, which of course is premixed, as you see. I underline this, it's premixed, we don't need to mix it. And it's setting with the moisture in the root canal. So very easy to use, very efficient, very ergonomic, very good to patients. Yes? This is, you can find it in America Pavilion, these instruments. I love them. They saved my life many times. And this is case from Dr. Kowalik, who is present here. Thank you, Michał. Easy placing of root canal sealer and gutta percha, little puffs. This is another case from Dr. Michał. And this is a little bit more complicated case because here we see resorption, right? And in this case, we have very open apical part of the canal, yes? And in this case, Dr. Michał advised me to use Centrix applicators, and I put Wellroot PT, yes, this is Dr. Michał's case, and the apical plaque we create from putty material, yes, Wellroot PT, and then normal sealer and gutta percha for the rest of the root canal. So it's very, very nice tooth-saving procedure. Wellroot ST has quite long, 10 years, something like this, publications history. Friend of mine, Professor Lipski, when I brought him, so my boss in the department, when I brought him samples from IDS many years ago, he made some initial studies. He found it excellent. We have more and more studies from many countries, not only from Poland, from Korea, from Germany. Lot of studies about Wellroot. So it's well experienced material. And here's another situation from Dr. Michał with apical plaque. Here's another strange case from Dr. He shared with me. I do not do such a sophisticated endo. And this, I was thinking it was kind of ninja access, but it's not ninja access. It's access from the buccal surface of the tooth to save the occlusal surface. Just a little bit different thing. I hope you will share with me my fascination of Wellroot PT, Wellroot ST. I saved many teeth. My colleagues are saving many teeth from endo. And we have for you, I mean VERICOM, yes? VERICOM has for you hands-on experience, and VERICOM has for you free samples. I can show you also at the booth how to place Wellroot to the canals and to the please play. We have artificial teeth, we have materials, and the employees of VERICOM also happy to help you with any questions. I'm also here to help you. If somebody of you would like to contact with me, here is my email. Thank you very much.
Thank you very much for your insightful presentation. If you have any questions, you can ask Dr. Pavel. And we also prepare hands-on experience. You can try and get free samples of Wellroot PT and ST.
So, yes?
Hands-on, okay.
Yes? So where's the table for over there?
Thank you.
Okay. Thank you. I will show you.
And don't forget to take your samples.